Hey, welcome to another episode of Sex Ed with Mel in 30 minutes or less here in Jefferson County in Colorado. So this month we're going to talk about birth control. So what is birth control? Birth control is something that you can use to prevent a pregnancy from happening if you choose to be sexually active. But before we talk about what's birth control, how do I use it, where do I get it, we need to talk about what is pregnancy. So pregnancy is what happens when a male and female-bodied person have sex, and that male person's ejaculation, the sperm, starts swimming, and it comes into contact with the female person's egg, and they combine, and they make what's called a blastocyst, which is when those cells start to divide on its way to becoming a baby, if it goes on for the whole pregnancy. So this fertilized egg, called a blastocyst, is just kind of hanging out in the fallopian tubes and eventually makes its way down into the uterus. And if that blastocyst implants, called implantation, that's when it attaches to the side of the uterine wall. And that's when a pregnancy actually starts. That's when the female-bodied person's body knows that they're pregnant and starts to make those changes in the body that go along with pregnancy. So what birth control does is it prevents either the egg and the sperm from meeting, or it prevents an egg from being released, or acts in some other way to prevent a pregnancy. So what are the types of birth control methods? Well, there's lots. The first one does something that's getting in the way of those sperm and the egg meeting. So they're both still there, still present, but there's something that's getting in the way of those two things meeting. So something that might fall into that category might include condoms or a diaphragm. There's also what's called hormonal birth control, which is something that a female-bodied person can take that prevents her body from releasing an egg. So no egg, no pregnancy. So there's lots of different methods that fall into that category, but something that you might have heard of would include the pill, the patch, the ring, and the shot. There's also what's called long-acting reversible birth control, and what that means is the female-bodied person uses it and can use it for up to 3 or 5 or even 10 years to prevent a pregnancy from happening. It's in, you forget about it, you're good. Some examples of long-acting reversible birth control would include the rod that's implanted into the female's arm, would include the IUD, which is a little T-shaped device inserted into the uterus by a doctor. There's also types of birth control that don't really fall into any kind of category, so they're just kind of the other types. Things that might fall into that other type of birth control would include things like spermicide, fertility awareness methods, withdrawal or pulling out, and then there's also what's called permanent birth control or sterilization, and that's when someone, either a male or a female, has surgery in order to prevent those sperms or eggs from being in a place where they can cause a pregnancy. That's a permanent option that you should only look into if you know you do not want any children or any more children. So one thing that's super important to know about most methods of birth control is that they only protect you from pregnancy. They don't necessarily protect you from STDs, or sexually transmitted infections. If you need to protect yourself from STDs, then you also need to use a condom to prevent those fluids or skin-to-skin contact that causes the transmission of STDs. So don't want to get an infection in your junk? Use a condom. It's also a good idea to back up your birth control. So if you're using a hormonal method, like say the pill, it's also a good idea to combine that with a barrier method, like a condom, because then you're using 2 types of birth control for twice the protection, even better. Sometimes it happens where you might make a mistake in using your birth control, or you're not sure if it worked or not. If that's the case, you can always obtain Plan B. It's also called the morning after pill. It's most effective if taken as soon as possible after sex that wasn't protected. Either someone didn't use their method or say the condom broke. You can get it either over the counter or at a clinic like the family planning clinics in your local area or a Planned Parenthood. But it should be available over the counter if you're over the age of 17. If you're under 17, you still need a prescription in most parts of the U.S. But you take it, and then up to 5 days after unprotected sex. It's most effective on day 1 with decreasing effectiveness the further along you go. If you for sure do not want to get pregnant, the only 100% effective method is not to have sex. But the bottom line is that if you choose to be sexually active and you're not ready to be a parent yet, then you need to use some type of birth control to keep yourself and your partner protected. So this was kind of your birth control 101, the bare bones basics. If you need more information about a specific method, check out our other videos, go ask Tish, give us a call to make an appointment to talk with one of our nurse practitioners, or you can visit the Before Play website for more info. Thanks. See you on the other side.